discuss or know more about health promotion activities. Therefore, what is the ultimate goal and educational objective of health education? The ultimate goal of health education is just provision of including health educator to improve the quality of life that we have seen at the beginning of this course using proceed model. So how social determinants of health, how epidemiological conditions, how educational and environmental issues, how policy dimensions and administrative issues and other are influencing the quality of life. Therefore, we need to bring or maintain or improve the quality of life so that health promotion and health education is very important. Therefore, the highest goal in life is to die young as the age of old and age is possible. Therefore, one of the things here is just a healthy aging. A healthy aging can be achieved by appropriate information plus enabling factors in place. So health promotion is very important. So to promote health, prevent disease, and adjust self-adjustment related to life with disability decreased and morbidity decreased and mortality decreased using the health promotion parameters. Therefore, educational objective of health education is all about providing appropriate knowledge, providing positive attitude, and just changing a behavior is educational objective. Therefore, what are the dimensions of health education? As health education is a lifelong process, it's not one-time process. It goes beyond. It goes beyond providing information. Plus, it can go with your lifelong processes. So it may start mothers in the womb and it will continue to have till death. So it is all lifelong process that is not one-time process. As you can see here from the triangle that health is one of the dimensions that we are going to achieve plus illness days. Therefore health illness triangle that you can see that you can provide health education for healthy people, you can provide health education for those who have been diseased or diseased individuals. The issue here is just keeping or preserving their health and improving their quality of life. So health education covers the continuum from disease prevention and promotion to optimum health to the detection of illness to treatment, rehabilitation, and long-term cares. Therefore, it includes infectious disease prevention, control of chronic disease, as well as attention to environmental issues. Therefore, health education delivered in almost every conceivable setting, including setting in communities, schools, healthcare, worksite, other too many churches, mosques, and everywhere that the target audience can enhance and maintain their healthy life. Therefore, health education is not an end by itself, it's a continuum of care. Health education is not limited to patient in clinical setting, it goes beyond clinical setting. So you can provide in any setting that can preserve health. Therefore, what are the principle, the guiding principle of health education? The first is the principle of diagnosis. As we have said earlier, health education is a combination of learning experiences designed to facilitate voluntary actions that is conducive to health. Therefore, through this process, we need to have, as a principle, we need to have behavioral diagnosis. What are the factors, what are the practices that lead to an individual to develop unhealthy behavior or some consequences? And what are the educational gaps that potentially bring change to the required level? Should be in place to make a decision. Therefore, principle of diagnosis is the first principle that we need to know whenever we are just planning to have an health education interventions and so on and so forth. The other is principle of participation. Principle of participation. Health education is more effective whenever the families, the relatives, the friends, and other important people surrounding us engage in. Unless otherwise, it is a waste of energy and time. Therefore, bear in mind that we need to have participating in others in order to bring a change. Therefore, for instance, if you have a plan to change a behavior in a teenage, yes? Hello? Hello, can you hear me, please? Hello?
Yes.
All right. Therefore, others, please mute yourself and please follow me. Therefore, principle of participation is very important. Allowing or engaging the families, working on the teenage, for example, engaged in unnecessary behavior so that they can support him to change a behavior. Therefore, it's very important to include them. The other is principle of planning, the principle of multiple method. As earlier, we have said that a combination of learning experience, therefore engaging different or implementing different intervention package should be there in order to bring the desired information. Therefore, what we have seen as an example of Chinese one-child policy or tobacco banning interventions and HIV-related interventions. Therefore, use multimodal approach, television, individual, group discussion, policy support, and others were there. Therefore, it's very important to include multiple methods. The fourth one is the principle of planning and organizing. As I have said earlier, health education is not only the incidental way of learning and teaching process, rather than it should be well planned. Planning for resource, planning for different human resource and financial resource should be there and should be organized in a manner that can maintain the flow. Therefore, it is always important to think in that way so that we can have the issue of just making impactful change to our setting. And the other is it should be fact-based, since we are talking about science and we need to have evidence-based. Updated information should be there in order to bring changes. Unless otherwise, people may get annoyed of or they are angry of us because we are telling them something which is not evidence-based. We need to have evidence and fact-based so that we can influence the desired behavior. Unless otherwise, they may be not interested in the interested that we are giving for them. Therefore, it's very important to think that how much my information is up to date and how much my information is necessary according to the need of the individual. The other is audience segmentation is very important. Therefore, according to the topic or the subject or the issue that you are providing, you need to segment your audience. For example, for those topics which are important for users, you need to segment them according to their age category. Or you can segment them with gender and different socioeconomic factors that you can segment according to their information needs so that you can impact the behavior that is important for health. The other is it should be need-based. Unless otherwise it's not easy to bring a change. For instance, maybe expressed needs are there. Maybe an individual can want to learn about want to get information regarding z.e.m.a or malaria or whatever their need. Or sometimes there might be agency-driven or organizational-driven needs are there. So some organization may contact you to provide information regarding some specific health problems. Therefore, in this case, you need to know which information are important to what group of people and what is the need. Seems like you need to do need assessment. Therefore, that's very important. And the eighth principle is known as culture. You have to respect the culture or the norms of the people that you are providing information. For instance, if I were planning to conduct health education interventions in Hargeisa or Somali or Kenya or somewhere else, I have to know what is the cultures in that specific city. Unless otherwise you respect the cultures and necessary information that can maintain their health, they will reject the information that you are disseminating because you are traveling or you are going against their norms or their culture. Therefore, bear in mind that respecting the culture is very important. The other is a principle of reinforcing, principle of rewarding people who perform a good behavior, positive reward. Or might be punishment. That is not a physical punishment, verbal way of just discouraging for smoking tobacco or smoking cigarette. Verbal way of discouraging not using condom when they are going to have commercial sex workers to do. Therefore, those issues are very important in health education as a principle. Therefore, what is the role of health education and promotion in primary health care? So, as you can know that the primary health care is a means of achieving health for all. This is possible if all individuals, families, communities, health professionals, government, and NGOs are involved in the program. For instance, the use of health extension package or health extension programs in Ethiopia. So, millions of daily decisions about health and disease are made by individuals and families at home, not by doctors or health workers. Therefore, it's very important to have, provision of appropriate information. Thus, if these millions of decisions are to be informed wisely, individuals and families are well equipped with information. If we improve the health literacy of the people, we can impact their health and we can bring or improve the quality of life. Therefore, primary health care is therefore very much concerned with health promotion and education. Health promotion and education. So you can apply health education and promotion in primary health care. So one of the core principles of primary health care is community participation. How we achieve community participation is through health education and health promotion. So the political issue or government decision, advocacies, educational issue, health education should be done in order to achieve community participation. Therefore, health education is an integral part of primary health care. Therefore, health education is a center to primary health care, and no component of primary health care can be successfully implemented without health education. That means all the components of primary health care have health education in its part. To have a role of health education in primary health care, as you can see that in immunization, as I have said earlier, we can inform mothers to bring their children and as well as to bring themselves to immunization. The other is food and proper nutrition. We need to have health education at the center to influence the behavior. And maternal and child health related issues. We need to inform the mother. We need to change the health literacy of the mother to decide and use the service. And safe and adequate water supply. How the WASH programs are applying health education as you know it. And prevention and control of local endemic diseases. How we inform them to improve health literacy and others so that they can seek a treatment or go to treatment so that we can improve their health-seeking behavior. And treatment of common disease and injuries, we need to have health education. We need to inform them. Unless otherwise, that is not easy. And if we have a provision of essential drugs, we need to inform them. Therefore, this all can help us to bring changes. So, what is the role of health education in primary health care? Health education is a tool for public health promotion. So, as through education that public health and biomedical information reaches to individual families, community to solve their problem through health education, unless otherwise. So the communication is very, very limited in case. Therefore, in public health educations and health promotions, there are also different dimensions that we can take data from public health, from environmental health science, from epidemiology, from population dynamics and biomedical science, are a major supplier of informations about the nature, type, the magnitude, and the problem of the required diseases or health problems. So once we have these problems or data deriving from epidemiology, from biomedical science, from different supply, we need to disseminate that information through health promotion. Therefore, it is entirely dependent on the health education and promotion activity. Therefore, health education at the center and individuals or personal behavior and lifestyle can be directly maintained through health education. Policy decision makers to influence environment issues as one dimension of health promotion, it can be maintained through health education. And public health and medical care practitioner also use evidence from their laboratories or other evidences from their experiment can be disseminated to the target audience through health education and health promotion in public health. Therefore, these are categories that the channels through which health education and behavior change approaches are initiated. Essentially, health education's activity can be directed as an individual to influence his or her behavior and habitual lifestyle, or at public and medical practitioner improve care and promote patient and public health educators. Or at policy level, we can make an institution to bring about involvement in social and physical environment affecting people's behaviors are very important. Therefore, having said this, what is what it look like the health education in health policy? I'm talking to the Ethiopian health policy, which is written in the preamble of 1993 health policy of Ethiopia. So it uses information, education, communications of health. It is stated as information, education, and communication of health shall be given to appropriate prominence to enhance health awareness and propagate the important concept and practice of self-responsibility in health. Therefore, it is the health policy of Ethiopia also emphasizes the importance of health education. At the same time, health education is one of the general strategy in health policy of Ethiopia. The fourth among 17 general strategies that has been set in the Ethiopian health policy. So it is one of the strategy to strengthen generally and for specific target populations through mass media, community leaders, religious leaders, cultural leaders, professional associations, school and other social organizations. Therefore, this is just to show us that how health education is just included in the health policy. So the health policy is generally prevention oriented, and hence health education plays a significant in the policy realization. So you can also check what seems like the health policy of your country and how health education and health promotion are included in that specific health policy of your own country. Therefore, health education in health programs, obviously, it has been included in Health Sector Development Plan 1 and Plan 2. So, health education is a cross-cutting issue in community health or workers programs or health extension programs of Ethiopia. Therefore, no comment of health extension package no component of health extension package successfully implemented without the presence of health education. And how the international agendas are linked with health education. So if you look into the past Millennium Development Goals, Goal 4, Goal 5, Goal 6 cannot be implemented without the presence of health education and health promotion, which is reducing child mortality, improving maternal health, combating HIV/AIDS and other diseases, which will not be implemented without the presence of health education. So without health education, these SDGs are difficult to achieve. Therefore, it is also included in the international as international agenda like SDG. Therefore, having leaving this discussion to you, and finally, this is your home take assignment that you are going to submit to me by tomorrow, which I'm going to share with you. Therefore, you can do individually and send to my email so that this is the question that you can send to me. So this is one of the continuous evaluations that I'm going to carry out. And I want to take a snapshot of who is involved in this, who is participated in this part. And if you have any question, please, you're welcome. You're welcome. Do you have any question?
No, thank you, sir. I think it's almost clear.
Exactly. So I think I'm taking attendance so that I'm seeing Hussein, Asma, and Smile. So the others and Abdi Fatah. Therefore, 1, 2, 3, 4 students out of 7 students, and I will. This is one of the attendance. At each day of the presentation, I will take the snapshot of the participant so that I will evaluate it out of 10. Therefore, Hussein, I'm going to send this presentation to you and to the team that which you can send me the assignment by tomorrow. And tomorrow we have, I think, in the morning we have the morning class.
Sure, yes.
Okay, thank you very much, and you can find the PowerPoint in the email. And have a good day.
Thank you. Thank you so much.
Okay.
See you. Thank you. Thank you.